50 Suicide Precaution NCLEX Questions, NCLEX Practice Questions. Introduction. Suicide precautions are among the most tested mental health topics on the NCLEX. Nurses must know how to recognize suicide risk, provide a safe environment, prioritize interventions, and communicate therapeutically. Test your knowledge with these 50 NCLEX-style practice questions. Question 1. A nurse is caring for a client who says, "Everyone would be better off if I weren't here anymore." What should the nurse do first? A. Tell the client not to think that way. B. Ask the client if they are thinking about suicide. C. Notify the client's family. D. Leave the client alone to calm down. Correct answer: B. Ask the client if they are thinking about suicide. Rationale: asking directly about suicide does not increase suicidal thoughts and helps determine the client's level of risk. The nurse must first assess whether the client has suicidal thoughts, plans, or intent. Strategy. When a client hints at self-harm, always assess before taking other actions. Direct questions about suicide are therapeutic and appropriate. Question 2. A nurse is admitting a client with active suicidal thoughts. Which nursing action has the highest priority? A. Provide reading materials. B. Place the client on one-to-one observation. C. Encourage group therapy. D. Offer a sleeping medication. Correct answer: B. Place the client on one-to-one observation. Rationale. Continuous observation helps prevent the client from acting on suicidal thoughts. Safety is always the nurse's immediate priority. Strategy: think safety before comfort. Clients at high risk should never be left unattended. Question 3. A client states, "I have already decided how I'm going to end my life." Which finding indicates the highest suicide risk? A. The client feels lonely. B. The client has a specific plan. C. The client cries frequently. D. The client refuses meals. Correct answer: B. The client has a specific plan. Rationale: having a detailed suicide plan greatly increases the likelihood of an attempt. The more specific the plan, the higher the risk. Strategy: plan plus intent equals greater danger. Specific details require immediate intervention. Question 4. Which item should be removed from the room of a client on suicide precautions? A. Tissue box. B. Plastic cup. C. Shoelaces. D. Pillow. Correct answer: C. Shoelaces. Rationale. Shoelaces can be used as a ligature for self-harm and should be removed. The environment should be free of potentially dangerous objects. Strategy: look for anything that can be used for hanging, cutting, or poisoning. Environmental safety is a key nursing responsibility. Question 5. Which statement by the nurse is the most therapeutic? A. You shouldn't feel this way. B. Everything will be okay. C. Tell me more about what you're feeling. D. Think about your family. Correct answer: C. Tell me more about what you're feeling. Rationale: open-ended questions encourage clients to express emotions and build trust. They also help the nurse assess suicide risk more effectively. Strategy: choose responses that encourage communication. Avoid false reassurance or judgment. Question 6. A client on suicide precautions suddenly appears cheerful after several days of severe depression. What should the nurse do? A. Reduce the observation level. B. Continue close monitoring. C. Prepare the client for discharge. D. Cancel suicide precautions. Correct answer: B. Continue close monitoring. Rationale: a sudden improvement in mood may indicate the client has decided to carry out a suicide plan. Suicide risk may actually increase during this period. Strategy: don't assume mood improvement means safety. Continue precautions until the provider determines the risk has decreased. Question 7. Which client has the greatest risk for suicide? A. A client with generalized anxiety disorder. B. A client with schizophrenia who has command hallucinations. C. A client with seasonal allergies. D. A client recovering from pneumonia. Correct answer, B. A client with schizophrenia who has command hallucinations. Rationale: command hallucinations directing self-harm significantly increase suicide risk. Immediate assessment and protection are necessary. Strategy: hallucinations that instruct self-harm require urgent intervention. Always assess whether the client intends to obey the voices. Question 8. The nurse understands that suicide precautions should include which intervention? A. Keeping the client's door locked. B. Performing regular safety checks as ordered. C. Allowing the client complete privacy. D. Restricting all visitors indefinitely. Correct answer, B. Performing regular safety checks as ordered. Rationale: scheduled or continuous observation helps ensure client safety while maintaining dignity. Regular monitoring reduces opportunities for self-harm. Strategy: suicide precautions balance safety with therapeutic care. Privacy should never compromise client protection. Question 9. A client says, "I saved all my medications because I plan to take them all at once." What should the nurse do first? A. Ask why the client feels sad. B. Remove the medications and stay with the client. C. Encourage the client to rest. D. Tell the client to promise not to attempt suicide. Correct answer, B. Remove the medications and stay with the client. Rationale: the client has both a plan and the means to carry it out, making this an emergency. The nurse must immediately ensure safety. Strategy: remove access to lethal means first. Never rely on a verbal promise for safety. Question 10. Which statement by a client indicates that suicide precautions have been effective? A. I still have a plan. B. I don't want to discuss my feelings. C. I will tell the staff if I begin thinking about hurting myself. D. I just want everyone to leave me alone. Correct answer, C. I will tell the staff if I begin thinking about hurting myself. Rationale: the client demonstrates willingness to seek help before acting on suicidal thoughts. This reflects improved coping and trust in the healthcare team. Strategy: look for evidence that the client will communicate suicidal thoughts and use available support. Seeking help is a positive safety behavior. Question 11. A nurse is assessing several clients in the psychiatric unit. Which client should the nurse see first? A. A client who says, "Life has no meaning anymore." B. A client requesting pain medication. C. A client refusing breakfast. D. A client asking for discharge paperwork. Correct answer, A. A client who says, "Life has no meaning anymore." Rationale: feelings of hopelessness are strong warning signs for suicide and require immediate assessment. The nurse should first determine whether the client has suicidal thoughts, a plan, or intent. Strategy: whenever a client expresses hopelessness or talks about death, prioritize a suicide risk assessment. Safety concerns always take precedence over routine care. Question 12. A client on suicide precautions asks to use the bathroom. Which action by the nurse is most appropriate? A. Allow complete privacy with the door locked. B. Accompany the client and follow the facility's observation policy. C. Ask another client to monitor the client. D. Delay bathroom use until the next shift. Correct answer, B. Accompany the client and follow the facility's observation policy. Rationale: clients at risk for suicide require observation even during personal care according to facility guidelines. This helps prevent opportunities for self-harm while preserving as much dignity as possible. Strategy: never sacrifice safety for privacy when suicide risk is high. Follow the prescribed observation level at all times. Question 13. Which client statement indicates the greatest immediate risk for suicide? A. I cry every night. B. I wish I could disappear. C. I bought a gun yesterday. D. Nobody understands me. Correct answer, C. I bought a gun yesterday. Rationale: Access to a lethal method combined with suicidal thinking greatly increases the likelihood of an attempt. Immediate intervention is required to maintain safety. Strategy: pay close attention to clients who have both suicidal thoughts and the means to act on them. Means plus intent equals high priority. Question 14. A nurse is developing a plan of care for a suicidal client. What is the priority nursing diagnosis? A. Disturbed sleep pattern. B. Risk for self-directed violence. C. Social isolation. D. Impaired verbal communication. Correct answer: B. Risk for self-directed violence. Rationale: preventing self-harm is the highest priority because it directly affects the client's survival. Other problems can be addressed once safety has been ensured. Strategy: use Maslow's hierarchy and ABCs to prioritize care. Life-threatening risks always come first. Question 15. Which statement by the nurse is most therapeutic for a suicidal client? A. Why would you want to do that? B. You have so much to live for. C. I'm here to listen. Tell me what's been happening. D. You shouldn't think about death. Correct answer: C. I'm here to listen. Tell me what's been happening. Rationale: this response encourages open communication without judgment or criticism. Clients are more likely to share important information when they feel heard. Strategy: choose responses that explore feelings rather than dismissing or challenging them. Therapeutic communication builds trust. Question 16. A nurse discovers that a suicidal client has hidden several tablets in a pocket. What should the nurse do first? A. Remove the medication and assess the client immediately. B. Document the finding at the end of the shift. C. Ignore the incident because no pills were swallowed. D. Ask the client to return the pills later. Correct answer: A. Remove the medication and assess the client immediately. Rationale: hidden medication may be intended for an overdose and represents an immediate safety concern. The nurse should remove the pills and reassess the client's suicide risk. Strategy: always act immediately when a client gains access to a potential means of self-harm. Question 17. Which visitor item should the nurse prohibit for a client on suicide precautions? A. Greeting card. B. Soft blanket. C. Glass perfume bottle. D. Family photograph. Correct answer: C. Glass perfume bottle. Rationale: glass containers can be broken and used to cause self-injury. All personal belongings should be screened for safety before entering the client's room. Strategy: inspect anything brought into the client's room. Remove objects that could be used as weapons or for self-harm. Question 18. Which behavior may indicate a suicidal client has made the decision to attempt suicide? A. Increased participation in therapy. B. Suddenly giving away treasured belongings. C. Asking for more reading materials. D. Taking longer naps. Correct answer: B. Suddenly giving away treasured belongings. Rationale: giving away valued possessions is a classic warning sign that a client may be preparing for suicide. This behavior requires immediate reassessment of suicide risk. Strategy: recognize behavioral warning signs, not just verbal statements. Changes in behavior may signal increasing danger. Question 19. A client says, "Promise me you won't tell anyone what I just told you." The client then admits having suicidal thoughts. What should the nurse say? A. I promise. B. I'll keep it between us. C. I care about your safety, so I need to share this with the treatment team. D. Let's forget you mentioned it. Correct answer: C. I care about your safety, so I need to share this with the treatment team. Rationale: the nurse cannot promise confidentiality when a client's life is at risk. Sharing this information is necessary to protect the client and provide appropriate care. Strategy: client safety overrides confidentiality when there is a risk of serious harm. Be honest while maintaining a therapeutic relationship. Question 20. Which nursing intervention is appropriate for a client placed on one-to-one suicide precautions? A. Leaving the client alone during meals. B. Maintaining constant visual observation. C. Checking the client once every 4 hours. D. Allowing unrestricted access to personal belongings. Correct answer, B. Maintaining constant visual observation. Rationale: one-to-one precautions require uninterrupted monitoring to prevent self-harm. Continuous observation allows staff to respond immediately if the client attempts suicide. Strategy: know the meaning of different observation levels. One-to-one means the client is never left alone. Question 21. A nurse is assessing suicide risk. Which factor increases the client's risk the most? A. Strong family support. B. Previous suicide attempt. C. Stable employment. D. Participation in hobbies. Correct answer, B. Previous suicide attempt. Rationale: a previous suicide attempt is one of the strongest predictors of future suicide attempts. Clients with this history require careful assessment and close monitoring. Strategy: remember that past behavior often predicts future behavior. A history of suicide attempts always raises concern. Question 22. Which statement by a client requires immediate follow-up? A. I'm tired. B. Nothing matters anymore. C. I miss my family. D. I didn't sleep well. Correct answer, B. Nothing matters anymore. Rationale: statements reflecting hopelessness may indicate suicidal thinking and require immediate assessment. The nurse should explore these feelings without delay. Strategy: hopelessness is a major suicide risk factor. Address these statements before less urgent concerns. Question 23. A client on suicide precautions asks for a razor to shave. What is the nurse's best response? A. Give the client the razor. B. Refuse without explanation. C. Supervise shaving according to facility policy. D. Tell the client to shave after discharge. Correct answer, C. Supervise shaving according to facility policy. Rationale: sharp objects should only be used under direct supervision when permitted by policy. This reduces the risk of self-harm while meeting the client's hygiene needs. Strategy: balance safety with dignity. Potentially dangerous items require supervision. Question 24. Which client is at the highest risk for suicide? A. A client with depression who recently lost a spouse. B. A client with a sprained ankle. C. A client with seasonal allergies. D. A client recovering from influenza. Correct answer, A. A client with depression who recently lost a spouse. Rationale: depression combined with a significant personal loss greatly increases suicide risk. The nurse should perform a thorough suicide assessment. Strategy: recent losses are common suicide triggers. Combine risk factors to determine priority. Question 25. A suicidal client asks, do you think life is worth living? What is the best nursing response? A. Yes, of course. B. What makes you ask that question? C. Don't worry about that. D. Everyone feels like that sometimes. Correct answer: B. What makes you ask that question? Rationale: this response encourages the client to express feelings and provides valuable assessment information. It avoids giving personal opinions or minimizing the client's emotions. Strategy: redirect emotionally charged questions back to the client. Encourage exploration rather than giving advice. Question 26. A nurse is caring for a client who attempted suicide by overdose. What is the priority goal? A. Improve appetite. B. Prevent another suicide attempt. C. Encourage daily exercise. D. Increase social activities. Correct answer, B. Prevent another suicide attempt. Rationale: after a suicide attempt, the risk of another attempt remains high. Protecting the client from further self-harm is the immediate priority. Strategy: after stabilization, continue focusing on safety. Recovery begins with preventing repeat attempts. Question 27. Which statement by the nurse demonstrates therapeutic communication? A. Everything happens for a reason. B. Others have bigger problems. C. I'm glad you told me how you're feeling. D. You should stay positive. Correct answer, C. I'm glad you told me how you're feeling. Rationale: acknowledging the client's willingness to share promotes trust and encourages continued communication. It validates the client's feelings without judgment. Strategy: support honest communication with acceptance and empathy. Avoid clichés or minimizing statements. Question 28. Which environmental modification is appropriate for a client on suicide precautions? A. Keep electrical cords accessible. B. Remove belts and sharp objects. C. Leave windows unlocked. D. Allow unrestricted access to medications. Correct answer, B. Remove belts and sharp objects. Rationale: removing potential weapons and ligature risks helps create a safer environment for the client. Environmental safety is a key component of suicide prevention. Strategy: scan the environment for anything that could be used to cause harm. Prevention begins before an emergency occurs. Question 29. A client says, I don't deserve to live. What should the nurse do first? A. Ask whether the client has thoughts of suicide. B. Tell the client that isn't true. C. Change the subject. D. Encourage the client to watch television. Correct answer, A. Ask whether the client has thoughts of suicide. Rationale: feelings of worthlessness may indicate suicidal thinking and require immediate assessment. The nurse should directly evaluate suicide risk. Strategy: assess first before offering reassurance or distractions. Direct questions save lives. Question 30. A nurse is preparing to discharge a client who was admitted for suicidal ideation. Which instruction is the highest priority? A. Follow up with the mental health provider and seek immediate help if suicidal thoughts return. B. Exercise 3 times a week. C. Eat a balanced diet. D. Avoid watching stressful television programs. Correct answer, A. Follow up with the mental health provider and seek immediate help if suicidal thoughts return. Rationale: ongoing mental health follow-up and knowing when to seek immediate help reduce the risk of future suicide attempts after discharge. Continuity of care is essential for maintaining safety. Strategy: discharge teaching should emphasize safety planning, crisis resources, medication adherence, and follow-up care. Clients and families should know exactly what to do if suicidal thoughts return. Question 31. A nurse notices a client on suicide precautions pacing, crying, and repeatedly saying, I can't do this anymore. What is the nurse's priority action? A. Encourage the client to join group therapy. B. Stay with the client and assess for suicidal thoughts. C. Tell the client everything will improve. D. Ask another client to provide support. Correct answer, B. Stay with the client and assess for suicidal thoughts. Rationale: the client's behavior and statements suggest increasing emotional distress and possible suicidal intent. Remaining with the client while performing an immediate suicide assessment promotes safety. Strategy: never leave a potentially suicidal client alone during a crisis. Assessment and protection always come before other interventions. Question 32. Which nursing action is appropriate when administering medications to a client on suicide precautions? A. Leave the medications at the bedside. B. Observe the client swallow each medication. C. Allow the client to take medications later. D. Give a week's supply at one time. Correct answer, B. Observe the client swallow each medication. Rationale: some clients may hide medications to use in a future overdose attempt. Watching the client swallow each dose helps prevent medication hoarding. Strategy: always think about how medications could be misused. Direct observation is an important safety measure. Question 33. Which statement by a family member requires further teaching? A. We'll remove firearms from our home. B. We'll lock up medications. C. We'll leave my loved one alone to rebuild confidence. D. Will attend follow-up appointments. Correct answer, C. Will leave my loved one alone to rebuild confidence. Rationale: clients recovering from suicidal thoughts should not be left alone if there is concern for ongoing risk. Family members should provide support and maintain a safe environment. Strategy: teaching should focus on supervision, reducing access to lethal means, and encouraging treatment adherence. Question 34. A client says, I hear voices telling me to kill myself. What should the nurse do first? A. Ask the client what the voices are saying. B. Tell the client the voices are not real. C. Administer medication and leave. D. Encourage the client to ignore the voices. Correct answer, A. Ask the client what the voices are saying. Rationale: the nurse must assess whether the hallucinations are commanding self-harm and determine if the client intends to act on them. This information guides the urgency of interventions. Strategy: assess command hallucinations immediately. They significantly increase the risk of suicide. Question 35. Which nursing goal is most appropriate for a client with suicidal ideation? A. The client will lose weight. B. The client will remain free from self-harm during hospitalization. C. The client will sleep 10 hours every night. D. The client will attend every group session. Correct answer, B. The client will remain free from self-harm during hospitalization. Rationale: maintaining the client's safety is the primary goal of care. Other goals become important only after self-harm has been prevented. Strategy: when writing priorities, focus first on preserving life and preventing injury. Question 36. Which statement best indicates that a client understands the safety plan? A. I'll keep my feelings to myself. B. If I have suicidal thoughts, I'll contact my support person immediately. C. I'll stop taking my medications if I feel better. D. I'll stay home alone when I'm upset. Correct answer, B. If I have suicidal thoughts, I'll contact my support person immediately. Rationale: reaching out for help is an essential part of an effective suicide safety plan. It demonstrates that the client knows how to respond during a crisis. Strategy: safety plans should include trusted contacts, emergency resources, and steps to reduce immediate risk. Question 37. A nurse is assessing suicide risk. Which question is most appropriate? A. You're not thinking of hurting yourself, are you? B. Have you had thoughts of ending your life? C. You wouldn't do something like that, right? D. You aren't serious about suicide. Correct answer, B. Have you had thoughts of ending your life? Rationale: this direct, non-judgmental question encourages honest communication and provides accurate assessment information. Leading questions may discourage truthful responses. Strategy: use clear, straightforward language when assessing suicide risk. Avoid questions that suggest the expected answer. Question 38. Which client should the nurse identify as having the greatest suicide risk? A. A client with depression who recently started feeling energetic after weeks of severe sadness. B. A client with controlled hypertension. C. A client recovering from a fractured arm. D. A client with seasonal allergies. Correct answer, A. A client with depression who recently started feeling energetic after weeks of severe sadness. Rationale: a sudden improvement in mood may occur after a client has decided to carry out a suicide plan. This period requires increased vigilance. Strategy: do not assume improvement equals recovery. Continue close observation until the risk has clearly decreased. Question 39. A client admitted after a suicide attempt asks, will I ever feel normal again? Which response is best? A. Yes, I promise. B. Many people recover with treatment, and will continue to support you. C. You just need to think positively. D. Don't worry about that now. Correct answer, B. Many people recover with treatment, and will continue to support you. Rationale: this response offers realistic hope without making guarantees. It also reinforces the importance of ongoing treatment and support. Strategy: provide encouragement that is honest and therapeutic. Avoid making promises you cannot guarantee. Question 40. A nurse enters a client's room and cannot immediately locate the client. What should the nurse do first? A. Finish documenting. B. Immediately search for the client and notify the team. C. Wait a few minutes. D. Assume the client is attending therapy. Correct answer, B. Immediately search for the client and notify the team. Rationale: a client on suicide precautions who is missing requires an immediate response because of the potential for self-harm. Every minute is critical. Strategy: missing high-risk clients are emergencies. Act immediately to locate the client and mobilize assistance. Question 41. Which finding suggests a decreased risk for suicide? A. The client refuses all treatment. B. The client identifies trusted people to call during a crisis. C. The client continues collecting medications. D. The client avoids discussing emotions. Correct answer, B. The client identifies trusted people to call during a crisis. Rationale: having supportive relationships and a crisis plan reduces suicide risk. It shows the client is willing to seek help instead of acting on suicidal thoughts. Strategy: protective factors include support systems, coping skills, and willingness to ask for help. Question 42. A nurse is caring for a client with suicidal ideation. Which intervention is inappropriate? A. Conduct frequent safety checks. B. Remove dangerous objects. C. Allow unlimited access to medications. D. Encourage therapeutic communication. Correct answer, C. Allow unlimited access to medications. Rationale: unrestricted access to medications increases the risk of overdose and should never be allowed. Medication administration should be carefully supervised. Strategy: eliminate access to anything that could be used for self-harm. Medication safety is a nursing priority. Question 43. Which client statement indicates hopelessness? A. Tomorrow may be better. B. Nothing will ever change. C. I'm willing to try therapy. D. My family is helping me. Correct answer, B. Nothing will ever change. Rationale: hopelessness is a major predictor of suicide and should always be explored further. The nurse should immediately assess for suicidal thoughts. Strategy: listen carefully for expressions of despair and hopelessness. They often precede suicidal behavior. Question 44. A client on suicide precautions asks why personal belongings were removed. Which response is best? A. Because we don't trust you. B. It's part of our plan to keep you safe while you're recovering. C. Hospital rules are strict. D. You'll get them back if you behave. Correct answer, B. It's part of our plan to keep you safe while you're recovering. Rationale: explaining the purpose of safety measures promotes understanding and preserves the therapeutic relationship. The response avoids blame or punishment. Strategy: when explaining precautions, emphasize safety rather than control or discipline. Question 45. Which action should the nurse include in discharge teaching? A. Stop medications if symptoms improve. B. Keep all follow-up appointments. C. Isolate when feeling overwhelmed. D. Ignore warning signs. Correct answer, B. Keep all follow-up appointments. Rationale: continued mental health care decreases the likelihood of relapse and future suicide attempts. Follow-up appointments are essential for monitoring progress. Strategy: stress the importance of treatment adherence and regular follow-up after discharge. Question 46. A nurse suspects a client is hiding suicidal thoughts despite denying them. What should the nurse do? A. Accept the denial without further assessment. B. Continue observing the client and assess for nonverbal warning signs. C. Discharge the client. D. End the interview. Correct answer, B. Continue observing the client and assess for nonverbal warning signs. Rationale: clients may deny suicidal thoughts while still being at risk. Ongoing assessment should include behavior, mood, and other warning signs. Strategy: assessment involves more than words. Watch for changes in behavior and emotional state. Question 47. Which client has the strongest protective factor against suicide? A. Strong family support and willingness to seek help. B. Living alone. C. Easy access to firearms. D. Recent substance abuse. Correct answer: A. Strong family support and willingness to seek help. Rationale: positive relationships and help-seeking behaviors reduce suicide risk. These protective factors encourage intervention before a crisis worsens. Strategy: remember both risk factors and protective factors for NCLEX questions. Strong support systems improve safety. Question 48. A client tells the nurse, "Please don't leave me." What is the best response? A. I have other clients. B. I'll stay with you while we talk. C. You need to be independent. D. Try to sleep. Correct answer: B. I'll stay with you while we talk. Rationale: remaining with the client provides reassurance, decreases isolation, and improves safety. Presence is often one of the most therapeutic interventions. Strategy: clients expressing fear or distress benefit from calm, supportive companionship. Never dismiss these requests. Question 49. Which assessment finding requires immediate intervention? A. The client reports enjoying music. B. The client has written a suicide note. C. The client requests a shower. D. The client asks about visiting hours. Correct answer: B. The client has written a suicide note. Rationale: writing a suicide note suggests preparation for suicide and represents an extremely high level of risk. Immediate safety interventions are required. Strategy: preparatory behaviors, such as writing notes or giving away possessions, require urgent action. Question 50. A nurse evaluates the effectiveness of suicide precautions. Which outcome demonstrates successful nursing care? A. The client remains safe, participates in treatment, and reports suicidal thoughts to staff. B. The client stays alone all day. C. The client refuses medications. D. The client avoids talking with the healthcare team. Correct answer: A. The client remains safe, participates in treatment, and reports suicidal thoughts to staff. Rationale: successful suicide precautions are demonstrated when the client avoids self-harm, engages in treatment, and communicates openly about suicidal thoughts. These behaviors indicate improved safety and trust in the healthcare team. Strategy: the best outcomes focus on safety, communication, and appropriate use of support systems. For suicide-related NCLEX questions, always prioritize interventions that protect life while encouraging ongoing therapeutic engagement.